welcome. So just wanted to make a note that today's Lunch and Learn is a webinar, so it is being recorded. Everyone's cameras are off and mics are muted, but you can go ahead and just raise your hand if you have any questions, or also feel free to drop them in the chat box or the Q&A. Today's Lunch and Learn also just wanted to note that it represents the collaboration between BC Children's Hospital Research Institute and the Women's Health Research Institute. So we're combining our two research institutes to have collective lunch and learns moving forward, which is really exciting. I also wanted to begin by gratefully acknowledging that our work at Children's and Women's Hospital takes place on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. And I'm going to turn it over to our guest speaker today, Sunita Minhas, Clinical Informatics Specialist with PHSA, for today's Lunch and Learn.
Thank you. Welcome, everyone, and thank you for attending this Lunch and Learn session. We're going to be talking about CST Cerner Go Live for Cycle 2. My name is Sunita. I'm a Clinical Informatics Specialist for Research and Clinical Trials, and I'm part of the PHSA Quality Practice and Clinical Informatics team. I was working with CST for C&W Research Go Live for the initial wave, and then I followed on with CST to help prep VGH for their Go Live. I just finished up prepping Cycle 1 Research Go Live, and now we're getting Cycle 2 ready. We have now collected our requirements from all the clinics from Cycle 2 who have noted that they had research. Next, we'll be doing some design and validation pieces that will need CST interaction. So just going to go over some of the things that we need to consider when your clinic is going live, or if you're in sustainment and you have a new research study that's going to be coming up, this would also apply to you. So a little agenda for today's session. I'll show you a list of which clinics are going live in Cycle 2 for early 2024. We'll talk about the Research Program Utilization Form process for any new studies which are going into CST Cerner. We'll talk about research integration into CST Cerner, what kind of build is needed for your research studies, depending on what's in your protocol. I'll show you a demo of some research tools which are available to you and your team in CST Cerner. I'll talk about access provisioning and training for Go Live and what the different research positions are. And then we'll have some time at the end for questions. And as noted, you can always put your questions in the chat as we go along. This is the list of clinics going live in Cycle 2. I had put some research questions in the initial clinic surveys, and we had made notes of which clinics had associated research going on in them. So if you are part of one of these clinics and you have not had a research requirements gathering meeting with either myself or Laszlo, if you could please put your name and email in the chat and we will follow up with you after. But there were some clinics that noted they did not have any research, so we have not met with some of those clinics so far. So how do we determine a research study that is starting up and needs to go into CST Cerner, again in sustainment or during your clinic's go live? We would need you to complete what we call a Research Program Utilization Form, and each study would need 1 PUF per study. We're please asking that you complete these PUFs for your studies by the end of this week. We had put a deadline for Friday, September 22nd, which is coming up pretty soon. Some exceptions to these PUFs, I'll note that if you have a purely observational study, a survey-only study, or a pure retrospective chart review study, you may not need a PUF, but things to keep in mind, these are only for accepted studies that do not have any research orders, no scheduling orders, no research billing, no documentation, and basically no interaction with CST Cerner or the new patient chart. Any studies that have any interaction with the chart, patient care kind of orders, we would need a PUF for all of those studies. So this is where you can find the PUFs. They're under the same website where you find the other institutional approvals. But this PUF is different than the research PUF that you may have done for operational or site approval. This PUF is down here at the bottom. It's called the CST Cerner Research Clinical Informatics Program Utilization Form. It's a informatics specific form that we need to assess so we can determine what your study needs are. And I'm going to show you what the PUF looks like. So it's going to ask you information about your REB, the PI and research coordinators' phone numbers, the start and end date of your study, how many participants you anticipate just at your site, so children's or women's, the study title, and then this part here is all the other services within the hospital that your study interacts with. And then this billing question we'll talk about during this presentation, so you have a better idea. The chart flag and the power trial we're going to talk about today, so hopefully you have a better idea if you need any of these pieces. But if you still don't know, you can just say you don't know and submit one of these. Along with the PUF, we also need a copy of your REB certificate and also your RISE application. So if you could send one of these PUFs plus the RISE plus the REB, here's the email at the top. But you can also send them directly to me. I'll put my email in the chat once I'm done with the slides. You can send all three of those things to either or email address, and that would be fine. And again, if you're going live with cycle 2, if you could try to get them in by Friday. If you're doing a sustainment project that's upcoming, you don't have to put it in by Friday. But if you don't have REB approval and you do have a complex study that is coming up in a different cycle or different wave, you could always submit these PUFs earlier and just put REB pending on this page here. You'll also probably note if you're part of cycle 2, you have some meeting holds in your calendar that have been sent out for research design and research validation sessions. These meetings may or may not be needed depending on what your study build needs are, but I can't assess your study needs until we've seen the PUFs and your RISEs. So depending on when I receive those and have them assessed, we may still need those follow-up sessions. And those follow-up sessions are mostly for research power plans, which I'm going to go into next here. So the most complex part of our build for research is a research power plan. So a power plan basically would contain all the medications, labs, diagnostics, patient care, and scheduling orders which are within your study protocol. So if you had multiple orders and drugs within your schedule of assessment or your sponsor protocol, we would get the builders to basically build them into the system as one plan. And the benefits of this is your provider, once your patient has been consented, can just order research ABC in the system. That whole protocol would come up for the physician to sign, and when the patient comes in for treatment, the orders would all be in there ready to go. And this is also set up so that all the research orders within the plan would be billed to sponsor, not MSP, but we'll get into that in just a minute here. So again, the power plans are designed on your study PPO, or what we call pre-printed order. I know a lot of studies at CNW don't have pre-printed orders, so it would just be the written protocol that you're following for your study. Power plans are usually linked to power trials, which we'll discuss in a little bit. And then the billing, an important piece, if you have research billable orders in your protocol, so if you have a research drug or a research CT scan or a research lab that needs to go into CST Cerner and needs to be billed to sponsor, and it's not a standard of care order that would go to MSP. That is an associated build in the system, but we will talk about that as we go along here. So this is just an example of what we call a pre-printed order or protocol order for a study at BC Cancer. Their studies are a lot more complex than the ones at C&W for the most part, because they contain a lot of chemotherapy and a lot of labs, but this is an example of taking their protocol and the builders building it into a research power plan. So all the PI would have to do is order this research ONC-P, BR plan, and all of these orders would be here ready to go for when the patient comes in. So if your study is deemed not appropriate for a power plan, if there's not that much complexity to it, or if you don't have any research drugs really, a lot of studies will end up staying on paper. But even if your study is on paper, you still may have some interaction with CST Cerner. So if your protocol has any medications that need to be given by a clinician and are dispensed by pharmacy, not drugs given by sponsor and given by the research staff, this has to be clearly ordered and documented in CST Cerner for safety reasons. So in this case, there would need to be a protocol signed by your physician, and that would have to be scanned into the chart after treatment. If you have any research labs, which are not external labs that are kept for sponsor, any labs that are going to go into CST Cerner and resulted back in CST Cerner, and any kind of medical imaging orders, CT scans, MRIs, or ECGs, which also need to be resulted in Cerner, these are still going to follow a paper requisition, but the departments will be entering those in on their own end. They call that department order entry. Pharmacy also would be taking your paper signed requisition and entering the medication into the system for the nurses. So that's another kind of build piece. You would have to do manual scheduling. We'll talk about some research scheduling options. And then the research billable report is if you have any of these orders that need to be billed to sponsor, the builders create a research account so that none of the orders go to MSP. And at the end of your study, you can actually print a bill that would show you the research orders at the end of your study. So as I mentioned, besides the power plan, these are kind of the different things we need to consider for each one of your studies. I'm going to go over these one by one. If you have any medications, labs, or MI orders, again, that are built to sponsor, they're not standard of care, we have to have a research account built in your system for billing purposes. And any medications which are given by a nurse or physician or CW clinical staff, we also have to build those in CST Cerner for medication documentation purposes. So this is, again, something we'll assess from your PUFs and your RISE whether this mandatory build is needed for your study. Research accounts we've talked about a little bit. It's basically a billing code. It's going to be attached to your research billable orders, but it's attached in the back end. You'll never see it. You don't have to do anything for it. I submit the request to our core team, and it's basically just a billing code made up your study name and your REB number. Lab, pharmacy, medical imaging then use that research account number on their end for billing purposes. Nothing you have to do, just something that I would need to know on your PUFs if you have these research billable orders. And here's an example of a research billables report. So some teams use this report at the end of their study. You can print it out and it'll show which studies were blocked from MSP, and then this can be given to your sponsor for billing if needed. Okay, moving on to Power Trials. Power Trials is a research-specific application in PowerChart, and I'll show it to you in the demo. It's basically used for recruitment and for patient lists. There's many different advantages of using Power Trials. It's composed of two components. Protocol Office Manager is where you would find general study information for the study. It's where you can upload study documents if you wish to, and it's where you can edit, delete, and remove any team members from your study team list, and we'll go over that in the demo. And then Patient Protocol Manager is where you can actually enroll patients into your study and have a confidential patient study list, again, if you choose to use this. Power Trials is only mandatory if we build a research power plan for you. Otherwise, the Power Trial is not mandatory. Your team can have one if you think it's beneficial. You can note that on your PUF, but if you don't see any benefit from it, it's definitely not something you have to use. So here are some of the advantages of having one. You can, again, have a patient list that's available for each study, and only the people that you put on your roles assignment can see that patient list. So the research coordinator has control over who gets to see that list. Some studies like to upload general study documents so that other clinicians who are caring for the patient have more information about the study. So some examples we've seen from other teams is a prohibited meds list, a study information sheet, or a study team contact list. So anyone who enters the patient chart would see the patients on a study if you wish for them to see that, and then they could see these documents. And I'll show you what this looks like in the demo. If you have a Power Trial, anyone going into the patient's chart, if they wanted to reach out to the primary investigator if they had questions or concerns, there's a clinical research tab that gets created with each Power Trial, and under that tab, the PI's name and phone number would be visible. Again, some teams find this helpful and some teams don't need it, which is fine. If you're in a research level 3 coordinator role, if you have a Power Trial, you'll receive a notification alert in Power Chart if your participant gets admitted to any other Cerner site in their inpatient or emergency space. And as I mentioned, the research coordinator gets to control who has access to the study's Power Trial. Even me as an informatics, I couldn't, or a nurse working at the hospital couldn't go into your study and see who's enrolled. This is strictly confidential and only accessible by your research team. And I'll show you that in the demo again. So here is my Power Chart. Can you tell me if you can see it? Someone give me a yes in the chat. Thank you. Okay, so I'm logged into Power Chart as a research level 3 coordinator, and this is just a train kind of domain. It's not real. The patients aren't real or anything. Power Trials are these two. Okay, 1 second. Hopefully you can see my Power Chart now. Yes. Okay, thank you, Nina. So Power Trials is these two applications up here. So they're named Office Manager and Protocol Manager. Let's go into Office Manager first. So they're set up the same way. They're set up by hospital or site here. You can expand the window here. So for this example, I'm a research coordinator for a study, and I just consented and enrolled a new patient. So if we build a Power Trial for you, I would send you a data collection worksheet, and on that worksheet, we would ask you which site are you under. Say you picked women's, say you picked Sunny Hill and BC Children's, then it asks you what subfolder would you be under. So these are kind of the categories we have built out so far. So let's say I'm under medical outpatient specialties, and let's say this is my trial. So under Protocol Office Manager, any physician could kind of see this general study information. What's the study about? And then they could reach out to your PI if they really wanted to know. Maybe they have a potential patient for your trial. That's kind of the only information physicians can see in Protocol Office Manager. But if you're the research coordinator, you will have access to edit and view the protocol. Again, this is only if we built a power trial and you've been named as a research coordinator, you would have this privilege. So under here, you can change the roles assignment under this little people button, and you'll learn about this in your training. So under here, say one of your team members left, you can easily delete who you don't want to have access, and then you can quickly add, say you have a new backup study coordinator, you put their role, you can search their name, you choose what position they're in, and then add. And yeah, this person's already on there, but you see what I mean. You can quickly add people, modify and delete using this application. And then if you wanted to upload a document, you would use this document manager. And just note, the documents you would upload, again, are not mandatory. It's totally optional. But they would be general study information. It wouldn't be like Mr. Smith is on this and doing this. It would be more like this study is using this device, and if you have any questions, call this person. It would be a general study information, and it would go on every single patient that you enroll on their chart. So if you wanted to put a study summary or other, you would just add the document here. As long as it's saved on your computer hard drive, you will upload it here. Now I'll show you what this looks like in the patient chart. So let's say we uploaded and enrolled this patient and uploaded them. They're going to now show up in your patient protocol manager. This is where you would actually enroll your patients. So again, categorized by hospital sites. We'll just go back to my test trial. Again, I uploaded some documents. And then if you want to add a new patient to your trial, you'd hit new enrollment and just search their name in the system. So let's say I enrolled my test patient here. So this is my list. Only my study team members can see it. And then you can easily access your patient's chart from this list. Okay, now that I'm in the patient's chart, it's a kind of a three-step process. So in Protocol Office Manager, you can figure out your roles on your team and upload documents if you want. Patient Protocol Manager is where you enroll the actual patient. So to connect this, once that's done, you can place this process alert on research study. Again, not mandatory unless you have a power plan, but if you want people to know patients on a study, it's easily put on with this process alert. And again, you'll learn this in your training, but it's basically you would search your facility, add this process alert. Now, any clinician who's gone into the patient chart will see this, and it should alert them if they have any other questions or concerns to check this clinical research tab. So these are the applications for you. This is what the other clinicians would see, and then they're supposed to know to come to this tab. And in this tab, if they wanted to contact the PI, they would see this is the contact name for the physician, and here's their phone number. Now, if you had chosen to upload documents to this trial, this is also where they would see the documents. So say this team wanted a study summary. The clinician or whoever would just open it up. And again, this is a test. You could put whatever you needed to put in this document. It would show up here. So are there any questions so far about power trials before we move on? You can unmute or put it in the chat, whatever you like. Okay, just some other things to note since we're in the chart here. This is another example of a research power plan that we built for CW in the emergencies called a ketamine study. So they gave us a protocol that had weights, vital signs, some communication orders, and then they had a drug kit and a respiratory consult. So this is what the builders built out for them. All the physician needed to do is put in PED research or put in ketamine, and it would show up in the orders. They signed for it, and then this plan, all the orders are basically ready to go. This is the most time consuming for you as the research team to give us the info and the builders to build, but the benefits are that these orders are all ready to go in one swift order from your physician. No one has to do anything manually, and the billing is all kind of done in the back end by the builders as well. So if you can kind of see in the yellow box, the research study, ketamine H21, that's the billing code that the builders are already set up. So the sponsor is billed for this drug, and all the other orders might be standard of care. That's something we would sort out ahead of time. Another note, if you're in an RL3 position, you have access to Message Center, which is basically an email communication tool right within the patient's chart. Again, some studies really enjoy using this application, while other teams still use their Outlook or whatever they're using outside of Cerner, but it's quite easy to send emails about your study participant. So the emails are specific to the patient. It wouldn't be for like non-patient stuff, but you can look up your patient, you can put in your provider or the other coordinators and send messages, and they'll get them in their chart. It also you can save this to the patient's chart if you need to. You can also use this to set up reminders about calling the patients or setting up appointments. You can put your reminder date and time, and it'll show up in your chart. Another thing I can show you is, let's see, you can show you documentation. If you're in a research level 3 position and you do patient visits and you do patient documentation or assessments, I'll go over the research positions next, but you have access to this research nurse / coordinator note. So it's a research specific note type where you can add your notes in, and it'll show up under the patient's documentation. And then if your PI or anyone needed to review them, they can also filter notes by research type. And your physician also has a research specific note called research clinic note. So if you wish to, you could use this tool. And one more thing I can show you, if you're in an RL3 position, you have access to do a couple of research scheduling orders. So they're not true orders in the sense that it's like a lab or a scan or a medication. What they are is research communication orders for things that need to be done for research. So RL3s can put in this research communication to nursing. And it's essentially if you have a sample collection in your protocol that the nurses need to collect, you can put this in as a reminder to the nurses, and it'll show up in their orders. If you have other sample collections that need to be done by the lab, we also have a communication order for that. And the third thing is you can schedule a research study visit. So if you're RL3 and you want your clerk to schedule a pre-screening research visit, an on-study research visit, or a follow-up research visit, instead of calling them or faxing them or doing whatever you were doing in the past, if your clinic's going live, you have the option to use this order. So you would just add order, schedule, and then it'll bring up a details page. And this request basically will go to your scheduling clinic's appointment queue, and then the clerks can book the appointments according to whatever notes you put in here. Again, this isn't a mandatory thing for scheduling. Some teams really like to use it. Other teams are still sticking to whatever their current process is, but it does work pretty well. My screen seems to be frozen here, but we would just basically need to know if your clinic is interested in using this function, because we would need your location, your clinic location, to be built into the list. I think I will go back to my PowerPoint. We have a couple more slides to go through. Okay, so we're going to talk about research positions. So these are the three research positions that are available for you depending on your role in the study. So research level 1, this is given to external monitor auditors and inspectors. And by external, we mean people who are not employed by a hospital site. And these positions, you cannot search for whatever patient you want. You would be given a patient list by the research coordinator of your team, and you wouldn't be able to just search for whatever patient that you wanted. For research level 2, it's usually given to data coordinators, and these positions can search for patients. They can use the Power Trials application. They can add that process alert. They can print labels and scan documents, but it's a read-only view Power Chart. So you wouldn't be able to document anything in the chart. So this is kind of the main distinction between 2 and 3. Research level 3, if you're involved in direct patient care, then you would be able to use Message Center. You could place those research scheduling request orders, and you can document in the chart. So depending on what role you have, what your duties are, and what your functions are, this is how you will choose which position that you need. I'm going to be sending out the survey probably early October. I wanted to get all the puffs in and assess those and send you many follow-up emails probably before we send the surveys out, but you can expect it sometime in October. I've put a detailed description of each position in the survey to help you decide what you need. You also need to put in your PI's name and contact number. They're basically acting as the manager of the study. You do need a PHSA network ID. If you have any questions when you get the survey and it's still unclear which position you need, you can always send me an email. Once we get your surveys in, the CST learning team will send you your required training. And we created research-specific Learning Hub e-modules that can be done online at your own time. They just need to be done, of course, before go live. There's a research quiz in there, but you can try it out as many times as you need. And once you've completed your courses, access and provisioning will then give you your access. But unless you have a power plan built for your study, you will not get access to Cerner until go live. So if you could please complete the survey, even if you already have access. They just want to have an up-to-date research clinic list, and we want to make sure your position that you may have gotten in previous go lives is the same as the position you need now. If you don't need any extra training, that's great. But some people are upgrading from level 2 to level 3, so they might just send you a couple extra modules to do. So what's next? If you could please complete a research puff for your studies by the end of this week, if you have not already. I think I've received 7 so far for cycle 2, but I'm expecting quite a few more. Once I get your puffs, I probably will send you some follow-up questions just to clarify and assess what is needed. We'll probably send out that survey, like I said, in October. If your studies need a power plan or any complex kind of workflow reviews, we can meet in the next month or two and go over your study specific workflows. And if you need a research power plan, we will have to book a design and validation session. Your primary investigator and research coordinator and the builders and research pharmacy, if there's a drug is involved, and myself will need to be in those meetings. So those meeting times we sent out could change depending on the builders and the pharmacy's schedules, but we'll determine that in the next couple of weeks. And after go live, if your team has new research users, the process is a little bit different. They need to fill out this access request form, and it will be done through the IMIT sustainment team. And please make sure each member of your research team sends in a survey. So it's 1 survey per person, per researcher. Just going back to